One of the things that I've noticed is that over the last 2 years, there's been a rapid increase in our awareness of mental health, matters related to children and adults, and their ability to process anxieties and traumas have been the focus of research within the scientific circles, TV and film, social media, as well as everyday conversations. The past few years have increased our awareness of mental health, leading to today's focus. What does mental health have to do with the local church? Hello and welcome to the Lead Square Call. My name is Malcolm Tyree. I am the host for our monthly conversation that we have that is designed to help pastors and congregational leaders think well about what is going on in our culture and what's going on in our congregations, and to help us multiply our leadership potential. I'm joined by Dr. Cindy West, who is a mental health professional. And so, Dr. West, take up just a moment here and tell us a little bit about your credentials in the mental health field. I know that you've been a counselor, a professor, but just kind of fill in our audience here a little bit about your background.
Okay, thanks, Malcolm. I appreciate being here today, and I appreciate you taking the opportunity to talk to churches about mental health because it's certainly a very important issue. So my background is in marriage and family therapy. I have a master's in marriage and family therapy, and then I also have a doctorate in counselor education and supervision.
Well, thanks so much for joining. And in addition to your work in family therapy and those sort of things, you also have kind of a close connection with the church, as your husband's been a pastor and you've been active in church ministry and served as missionary and served in church leadership. How the idea of mental health and the good news of Jesus quickly comes together.
Oh, well, absolutely. I mean, the good news of Jesus is the foundation. If we don't have him in our life, then, I meet a lot of people who struggle with crises and various things because they don't have him in their life. They may have other ways of coping, but I think they're missing that prime foundation. And he's the one that keeps us solid for eternity, not just for what's happening here today, but forever. So absolutely, that's my foundation.
As you've been working in the field since the 90s, as you said, how has the field of mental health increased in awareness, in the public's eye from your perspective?
Well, it's definitely become a lot more prominent. Stigma has always been kind of associated with mental health, going to a professional counselor. If you have a mental illness, you don't talk about it. That has decreased over the years, and we don't have as much of a stigma, but it does continue to be an issue, especially in certain cultural groups, going to see a professional. So we still have some work to do, but because of the increase in awareness, people are much more readily taking advantage of mental health services and going to providers who are helping them.
So let's talk about
Um,
those concerns for just a moment. I
mhm.
mean, there's like an overwhelming sense of anxiousness that is going on in our society that may be related
Yeah.
to the fact that we are just bombarded with information and feel as though our control is limited. Who knows what it is? But as you think about it, and you're talking with your colleagues and those you're supervising, what are really those top concerns that you think that church leaders need to be aware of as it relates to what people are seeking guidance for in the field of mental health?
Well, certainly there's family issues, but the biggest concern is really suicide and suicidal ideation, which goes along with depression. It can also go along with anxiety, and that's one of the top concerns because suicide is the second leading cause of death among young people. And prior to the COVID pandemic, it was the 10th leading cause of death in the nation. So it is considered a top cause of death or a leading cause of death. Every year in the United States, more people die by suicide than by car accidents. So, and more suicide deaths occur than homicide and AIDS deaths combined. So we see this, this huge influx of people who are dying by suicide. Within the time that we talk, every 11 minutes somebody dies by suicide. So
Mm.
there will be at least 4 to 6 people who will die within the 1 hour of your Lead Square call. So it's a
Wow.
lot of people, a lot of people. And for every one person who dies by suicide, 316 people seriously consider suicide, but they don't kill themselves. So there's a lot of people dealing and struggling with these thoughts of harming themselves, these thoughts of, how am I going to live my life? How can I go on? How can I continue?
Yeah, those are pretty staggering numbers when we think about the number of
Yeah.
people who are engaging in suicide, and clearly a high risk category of folks, as they're contemplating life or death. And it's good to see that, again, we're getting an increased attention to this matter. So suicide's obviously very high up on the list. What are some other top concerns that you're seeing or hearing about that people are coming in to seek counseling for? And maybe even is there a common connection that people are expressing as they're wrestling through, is my life worth living?
Yeah, well, there's a lot of family issues going on, marital conflict, issues with their children, issues with their grown children. There are, again, young people have greatly increased in terms of their depression, their anxiety, the various suicidal thoughts that they have as well have increased significantly. Several studies have been done about this regarding young people, teenagers, as well as young adults who since 2000, like 2005 to 2017, almost 30 to 50% increase in the number of mental illnesses that are occurring in these people in this age group. But it isn't so with the older generation, like the 65 and older seem to be more stable than that. And so these researchers are starting to look at that and they're saying, why is this that the young people seem to be having an increase in mental illnesses and severe mental illnesses too? We're seeing some serious, bipolar and substance abuse. We're seeing, there is a fentanyl crisis right now, and you've probably seen it on the news as well. So there's a huge substance abuse crisis with our young people as well. But one thing that they found is that the digital media is probably contributing to some of this increase because they're growing up with the digital media. And these screens actually affect the pineal gland because there's a blue light that's hitting the pineal gland, which helps us to sleep at night. It used to be that we would have a light behind us and we would read and then our heads would fall and we would fall asleep. But now we've got these screens and kids are looking at their phones and they're staying awake late. They're looking at their phones in the middle of the night and they're not getting the sleep that they need. In fact, there's a 10-year-old right now who just doesn't go to sleep and we're trying to figure out how to help her go to sleep. And digital media does have a big impact on that because of all of the screen influence and because of the stimulation that they have going on. So how do we help them with that? I think we'll get to that in a minute, but there's certainly an increase.
Yeah.
There's certainly an increase in depression and anxiety through there, and also family violence. When families were at home, the kids during COVID, they didn't get a break. And so family violence increased because they were stuck at home. And then, of course, their depression increases and their anxiety increases because they're dealing with all of this stuff while they're at home. So we've seen an increase in a lot of different areas in mental health, particularly since the pandemic. And what I'm finding is that there are not even enough therapists to deal with all the intakes that are coming in.
How does the Bible, from your perspective, speak to the issues of mental health, particularly maybe the ones that we're facing today?
It's about not worrying about tomorrow. It talks about putting our anxieties on the Lord. It talks about, in Ecclesiastes, there is a time to weep, there's a time to mourn, there's a time to cry, but there's also a time to rejoice. So we need to recognize that, we can't just say, oh, forget about it, that's COVID, leave it alone, because people are still mourning. They're still in a crisis. There are people who are still losing loved ones, and there are people who have still not gone back to work. I was just reading a report a couple of days ago that said 72% of people who had a job change as a result of COVID said they regret it and that they don't like their new job. So we're dealing with some really significant issues just as a result of the pandemic. And I think that what the Bible tells us is that we have a firm foundation. We have the Lord to be able to rely on for that constant in our lives. But we also need to recognize that there's going to be some grief. There's going to be some weeping. There's going to be some anxiety that's there. And to just say, oh, get rid of it, rely on the Lord, may be a little bit trite, if you will. We need to perhaps give it a little more emphasis and recognize that these are some real issues that people are facing. And we do have that foundation, but we can't just say, get over it. We have to say, how can we help you through it? Pastors need to realize that most people will go to a pastor before they will go to a professional counselor. And so you are their first line of defense. And if you just immediately refer them to somebody, that may feel a little bit like a put off. And so we need to stop and listen to them and spend time really hearing what's going on with them. First of all, to even know where to refer them, because we're not going to really know where to refer them if we don't know kind of what they're dealing with. Also, in the counseling business, as I was teaching counselors, we had pastors who came to get their professional degrees. We had teachers, we had police officers. And what we found is that those who are in the business of sort of solving problems, they had a harder time sitting down and listening. Pastors have to come up with a problem and a resolution within 30 minutes and be off the stage. We can't do that in counseling, So what we found is that within 8 minutes, they were giving them the result. They were giving them, here's what you need to do. Here's how you need to fix it. And they weren't spending enough time just stopping and listening and hearing what the counselee had to offer and what they were dealing with in order to really know how to help them. So I think that's the first thing, is to just spend some time really listening. Now, pastors don't have a lot of that time. So I think that pastors need to surround themselves with ministers within the church who can help to provide the actual services to these people inside the church. So, for example, find people who can start a marriage ministry. Prepare and Rich is a great marriage ministry with 40 years of validation. Pastors have time to, perhaps sit down with somebody on a one-on-one session or a couple session, but they're not going to be able to do 6 or 8 sessions to work through all of these different deals. So that's where surrounding yourself with other people in the church who can be the ministers can be very helpful. Maybe even bringing in a counseling, a counseling program into your church. It doesn't even have to be a professional counselor. It can be a lay counseling situation. So I think that's something else that pastors can do, is to begin to promote the resources that are out there. Talk about suicide in a very real manner, not just, kind of what's happening out there in the surface, but, every 11 minutes, somebody's killing themselves. We've got to do something. Texas, by the way, ranks number 51 out of 51 states, including the territories. We have the lowest access and the most problems. So if there's not access in the community, then the church does need to do something. Yeah. We've got to find a way to help these people so that they can get the support that they need, because they're probably not going to find, I said earlier, we don't have enough people to do all the intakes that are out there. So I think that's where the church can really begin to fill the gap, avoid the language that polarizes people and helps to bring more, bridge more of the gaps and helps to provide more common ground, particularly when you're dealing with mental illness. And then also connect with mental health professionals in your area. Understand what the different services provide. The psychologists, the psychiatrists, mental health counselors, marriage and family therapists, social workers. Get to know what they do that's different so that you know who you need to refer to when there is a particular crisis with somebody inside your church, as well as somebody who shows up from the outside, or if you're working with those outside.
Our problem right now is not necessarily a lack of information. Our problem right now, isn't a lack of available resources. It seems like, the great challenge that we have is the lack of connectors, of individuals who know the information and resources to be able to connect it with the person who is in kind of that crisis moment, or not just the crisis acute moment, but also the longer term, kind of the therapy that is needed to, in some sense, rehab a part of our emotional state or psychological state that has been wounded or damaged and just needs to be strengthened, much the way that an arm when it's been broken needs to go through some rehab so that the muscles, which have been atrophied, have a chance to be restored. So, yeah. Uh,
But we may not have we may not have the resources, because remember, Texas ranked 51 in terms of access to care.
mhm.
So we may not have the resources even available to us. And that's why I think the church needs to step up. And, maybe the church can even be involved in helping to start or fund or whatever some of the resources that are out there or that need to be out there in the community. Find out what's missing in your community and be an advocate for helping those resources to come to your community.